So I've been told that the mic doesn't actually do anything for you guys, but it's good for the recording. So I'm going to hold the microphone. But I just want to, thank everyone here for the opportunity to come and speak to you now this afternoon on a very, very important topic, certainly for ISDH and certainly for all of you as you were able to share kind of who you are, where you're from, and what you do and what you provide. I think it's really important to have opportunities to connect like this and share that type of information so we don't miss those opportunities for partnership and certainly can provide as many resources as possible to move some of those indicators that we know are all very important in the state of Indiana, but specifically when we talk about moms and babies and improving the quality of life. Like I said, it's really about being able to share these resources and connect at the community level because we know that's where the best work can get done and we can really start to drive some of those indicators down. So again, I appreciate it. I am Brian Busching with the Indiana State Department of Health as well. I'm actually with the Tobacco Prevention and Cessation Commission. So it's a different division than maternal and child health. But just to give some context, so we certainly work on statewide efforts to reduce tobacco use across the state of Indiana. Specifically, we have 4 priority areas that we focus on, and this is all based on what the evidence suggests and supports. So everything that we do is certainly driven by what the evidence suggests. So just to give you those 4 priority areas, we certainly want to reduce youth tobacco use and hopefully eliminate any opportunity for initiation in the youth population. We also want to work on reducing inadvertent exposure to secondhand smoke. So that's a lot of our policy work around the state. We also want to focus on reducing adult tobacco use, so that's our 3rd priority area. And then lastly, our 4th priority area is really focused on building the infrastructure around the state to continue to drive down tobacco use rates and reduce the tobacco burden in the state of Indiana. So you're actually going to hear from Pat, I think, during the panel, Pat Turner, and then Tammy is here as well, and then Nancy is here. They are actually one of our local partners that we fund around the state to work on tobacco control at the community level. And they work on a work plan that is focused on those 4 priority areas. So it's great to have them in attendance and just know that you have a local level team of experts that work on tobacco control that are driving or pushing out a lot of the same efforts that we talk about at the state level. So without further ado, let's go ahead and jump in here. Just to give you an overview, we're going to talk a little bit about the burden of tobacco use in the state of Indiana because I think it's important to know what those statistics show. We're going to talk about those poor health outcomes associated with smoking and tobacco use. And then lastly, I think that one of the most important things for today's discussion, what are some of those strategies that we can try to employ here in Allen County or the region and certainly across the state to help drive down those tobacco use rates. So just to get started, I always like this graphic because I think it's a good way to show that certainly when we talk about burden, it's not just the health outcomes burden, if you will. It's certainly there's an economic burden in the state of Indiana that impacts us all. So even if we're not directly connected to somebody who's using tobacco, or maybe we aren't spending money directly on tobacco products, we are all negatively impacted, unfortunately, from an economic perspective. Specifically for every pack of cigarettes sold in the state of Indiana, you see that we spend about $15.90 in healthcare costs, lost productivity, and premature death. Just to give you kind of what that overall or the general economic burden for the state of Indiana, we have nearly $3 billion in annual healthcare costs. $590 million of those are associated to Medicaid annually. So unfortunately, a huge financial burden in the state of Indiana. We have just about over 1,100 deaths annually related to smoking. Our smoking rate is about 20.6%. So it's just over 1 in 5 Hoosiers report smoking. This is adult Hoosiers that report smoking. And then I think the key here to tie it back to why it and how it all connects or directly impacts us, annually it costs every Indiana taxpayer about $900 per household to pay for smoking-related healthcare costs, more or less, or smoking government-associated costs. So That's how we're all impacted by tobacco use in the state of Indiana, whether you think you are or you don't think you are. You are. I'm telling you, you are. But to drill down to some of our priority populations, and certainly smoking during pregnancy is very, very important to us down at the State Department of Health. Infant mortality was our top priority really over the last 2 years, I want to say. I think it's kind of shifted this current year, this current fiscal year, to the opioid epidemic has kind of shot to the top. Infant mortality is certainly still there. There's still certainly a connection there, and obviously tobacco use is interconnected with those two things as well. But when we look at the stats that focus on smoking by Indiana women, you can see this graph does a nice job of kind of breaking it down by age range, and specifically for the smoking rate with women ages 18 to 44, we have about 23.5%, so that is a little bit higher than the adult smoking rate in the state. When you look at specifically smoking during pregnancy in the state of Indiana, we come in at just over 14% of our women report smoking during pregnancy. That's about double the national average, which is about 8%. But when you hone in a little bit more and look at the Medicaid population, so women who are pregnant and also on Medicaid, they report smoking at about 25%, a little bit over 25%. And when you get into some of these different counties, that number obviously skyrockets. But what we're basically saying is you have about 1 in 4 women who are on Medicaid that report smoking during pregnancy. Huge, huge concern across the state, and certainly a lot of work left to do to try to bring that number back down. A little bit more about the economic burden specific to smoking during pregnancy. You can see that in the U.S., smoking attributable neonatal healthcare costs total nearly $150 million annually, or $353 per pregnant smoker. For Indiana, that's estimated to be about $4.8 million annually. And we have about 12,000 smoking-affected births in Indiana every year. So we know that while there is certainly a financial burden or economic burden, there's also the negative health outcomes that are associated with smoking during pregnancy. 20 to 30% of low birth weight babies can be attributed to smoking, 2 times the risk of SIDS than non-smoking mothers, higher incidence of ectopic pregnancy, 30 to 50% higher risk of miscarriage than non-smokers. And I wanted to show this because the 50th anniversary of the Surgeon General's report, which was actually the 32nd report released in 2014, causally associated smoking with ectopic pregnancy as well as orofacial clefts in infants. Additionally, 108,000 premature deaths from conditions related to infant death were caused by smoking and secondhand smoke exposure from 1965 to 2014. So again, I want to share all this because we know the evidence supports some of these strategies that I'm going to talk about in the future, but I think it's important for us to know kind of where we've come from, where we are currently, so we have a good understanding of certainly where we want to continue to go, hopefully, but really just good context, I think, to understand kind of where we're at nationally and then certainly for the state of Indiana. So how did we get to this point? It shouldn't be any surprise that the tobacco industry is still alive and thriving, unfortunately, and they're not going away. But certainly, some of you may be familiar with some of these ads, some of you may not be, but the tobacco industry is very smart. They've done a lot of research on human beings in general, and they certainly directly target individuals with some of their marketing. So I want to just share that, from 1930s on, basically, tobacco companies had developed campaigns to target women. Each decade, they tapped into the values of women at the time and certainly developed women-specific cigarettes. I don't know how many of you are familiar with Virginia Slims. That is a type of tobacco products that's very much targeted towards women in the nation. So additionally, to give you some more current ads that are out there, so this just gives you an idea of how they do target specifically to women, young women, and these are more focused on electronic devices, which I'm sure a lot of you are familiar with nowadays. Certainly seen a big uptick in the usage of electronic devices, unfortunately, which could lead to a plethora of public health issues if you get somebody starting on an electronic device, maybe because they're just interested in it, or maybe because they think it's safer for them. Bottom line, it still has nicotine in it, and we know how addictive nicotine is. So potentially just setting themselves up for a lifelong addiction to nicotine, and who's not to say that they could transition to combustible tobacco products, meaning cigarettes, cigars, things of that nature. So just wanted to give you an idea of what some of that tobacco industry marketing looks like and how it's very targeted at different priority populations. So what are some of the things that we can focus on to try to help reduce tobacco use, specifically with women and certainly during pregnancy? So we at the Tobacco Prevention and Cessation Commission specifically provide or contract for the Indiana Tobacco Quit Line. So we provide that program through our division. The Indiana Tobacco Quit Line, if you're not familiar with it, is a telephone-based counseling option. It is also offered over the internet, a program called Web Coach. So individuals who are reluctant to talk to someone over the phone can access an online version of that counseling and receive that counseling via that route. We also have a texting-based service called Text to Quit that individuals can access if they would prefer to stay connected over their mobile device. But at the end of the day, it's available 24 hours a day, 7 days a week. It is free of charge to anyone in the state of Indiana who is interested in trying to make a quit attempt. So certainly based on all the different programs that I heard about and all the different services that are offered in this room, this can be a nice complement to those services. It really goes back to understanding all the different resources that are available. That's what's so great about this directory that you guys just heard about, but know that this can complement and support the resources that are currently available in and around this area. So we want you to be trained enough or educated enough, I guess I should say knowledgeable enough about what the service is, so when you are interacting with a tobacco user, you can feel confident in knowing what you're referring them to if they are in fact interested in connecting with the Indiana Tobacco Quit Line. There's a couple different call structures within this programming, but specifically what I want to highlight today is the pregnant population and what they are provided with through the Indiana Tobacco Quit Line. And I don't want to take away from Pat and some of the things that she's going to talk about, but there is a 10-call program for the pregnant population in the state of Indiana. So when I say 10-call program, they get 10 outbound calls. Think of those calls as sessions that they're going to have with a highly trained quit coach. Quit coaches are trained in cognitive behavioral therapy. They're the experts when it comes to counseling individuals, setting up a quit plan with that individual, working them through their quit continuum. It's really about the personalization, the tailoring of the programming when that individual tobacco user connects with their quit coach. So I think the main thing to try to take away from this conversation is that feel confident in knowing that you're referring them to a resource, an experienced quit coach that is going to be able to help them through their quit process if indeed they're interested in trying to quit. Another piece of the quit line, we know that counseling support is very, very important to help somebody successfully quit. There's medication support also offered through the Indiana Tobacco Quit Line. In the state, we do offer a 2-week supply of NRT, nicotine replacement therapy, in the form of gum or patches to anyone on Medicaid, Medicare, or uninsured. So those three populations do qualify for a 2-week supply of NRT in the form of gum or patches. Quit coaches will discuss all 7 FDA-approved medication supports with a tobacco user. So just know that they'll have that conversation with them. Certainly the pregnant population, they will not automatically qualify for a 2-week supply of NRT. The quit line does require a physician's script for that 2-week supply free of charge. They're gonna strongly recommend that individual, if she is pregnant, engage with their healthcare provider on, do we think nicotine replacement therapy or some form of medication is necessary for you, as opposed to continuing to smoke cigarettes or smoke cigars, whatever it may be. So that's just a little bit about the pregnant population program that we offer. There are 2 postpartum calls. So I think we're all pretty aware that mothers, expectant mothers, are typically willing to try to quit during the pregnancy, but as soon as they give birth, they unfortunately pick up the habit again. So the 2 postpartum calls is, I think, something that's really important to note as well, as we talk through what the quit line is and what the quit line can offer. Just a little bit more detail about the quit line and the information on how it reaches women. 60% of callers are women to the Indiana Tobacco Quit Line. Based on our state fiscal year 2014 evaluation, about 2,600 women of childbearing age. So the quit line will serve anybody 13 years and older. And I don't want to just limit it to pregnant women. We're really talking about women of childbearing age. So those women who are thinking about potentially getting pregnant or having children, we really want to try to get them before they become pregnant, certainly. So just know that the quit line will serve anyone 13 years and older. But back to some of the numbers, 300 pregnant women enrolled in services in state fiscal year 14, and then 150 women enrolled in the actual 10-call program. What we've noticed is that women don't necessarily know about the 10-call program, so they just call and enroll in the regular programming that we have, which is a 4-call program. We really want to make sure they are aware that they do get more services from the quit line if they are, in fact, interested in getting that counseling support throughout their pregnancy, and then those 2 postpartum calls as well. Okay? So, talking about the tobacco industry and some of the marketing that they do, one of the strategies that we certainly try to employ at the State Department of Health and Tobacco Prevention Cessation Commission is some counter marketing, if you will. And this you can think of this in a lot of different ways, but these are just a few examples of how we've tried to produce some additional marketing focused at or targeted at women of childbearing age and certainly pregnant women. These can both be mailers, flyers. We've done some radio ads around the state as well, really helping to try to drive awareness about the quit line and hopefully drive people to want to try to make a quit attempt. Additionally, we've had a campaign where we really focused on the importance of connecting with your healthcare provider. Again, trying to drive these individuals to talk to medical professionals about the importance of quitting, and then hopefully having the medical professionals understand what resources are available in and around the community and help drive those individuals to those resources. So this is something that we did a couple years ago. We had some billboards placed around the state, and certainly some direct mailers to healthcare providers that we have been connected with in the past. Additionally, when there's national media helping to drive the awareness and the education on the importance of quitting, this is CDC Tips from Former Smokers campaign. I don't know how many of you are familiar with it, but these are real people who unfortunately have experienced some sort of adverse health outcome or just a negative experience in general in their life because of their tobacco use, whether it be direct tobacco use, whether it be exposure to secondhand smoke. I strongly encourage you to become a little more familiar with CDC Tips from Former Smokers if you're not. A lot of good resources there that at the end of the day talk about real life people and what truly happened to them based on their tobacco use. So this is Amanda, certainly highlights her reason to try to quit smoking, which was the birth of her child. But just know that media campaigns can help drive awareness and certainly drive individuals to want to try to quit. So as healthcare providers or as partner organizations, understanding that this is generating that awareness and that buzz. And if someone maybe is out in the community, let's say a pregnant mother sees this ad and then comes to you and as a provider and has that same conversation, that's going to help to motivate them to try to quit their tobacco use. And the main drive for this, or the main action item from CDC Tips from Former Smokers, is to connect with 1-800-QUIT-NOW. But again, I want to reassure you that it's about support at so many different levels and all the different resources that can be kind of coordinated together to make sure that our pregnant mothers and expectant mothers are aware of what's available to them. So something else that I think is really important, and some of you may be familiar with it, this is the brief intervention that we recommend. So if some of you aren't familiar what you can do when you're talking to an expectant mother or a pregnant mother, we know that time is very, very, important in the healthcare sector, and there's not a lot of time, unfortunately, to have the meaningful conversation that I think needs to take place to really help motivate somebody. We recommend Ask, Advise, Refer. And I know that this is really, I'm going to speak to it basically specific to the healthcare sector, but try to think how you can apply this in your different organizations, your different interactions that you have with expectant mothers or pregnant mothers to help them try to understand the importance of quitting. But Ask, Advise, Refer, we need to identify a tobacco user first and foremost. I think most healthcare systems are doing that, so that shouldn't be an issue. Now, how they're identifying it, I think may vary. What question they're specifically asking. Are they just asking about smoking, or are they asking about tobacco use in general? Because that's what we really want to get at, is tobacco use. You need to advise on the importance of quitting. And this really just needs to be relevant to the individual. What is important to them? What's going to help motivate them or drive them to want to try to quit? Maybe it's some of the associated health outcomes that you comment on to them or speak to them about. Maybe it's the financial burden that it's placing on them. Maybe it's placing some unfortunate circumstances on the family as a whole. But at the end of the day, advising them on the importance of quitting and letting them know that you're there to help, that you can help, that you want to help. And then ultimately referring them to a local resource. Certainly for us, the Indiana Tobacco Quit Line is what we would recommend, but also understanding that there's other resources out there and referring to them to those resources. Not to spend a lot of time on the methods of referral, but we do have a fax referral form that you can access at quitnowindiana.com. That's our consumer website that talks about the Indiana Tobacco Quit Line. Hopefully it can take a little bit of that mystery away if you have an expectant or pregnant mother that's not quite sure if they want to use the Quit Line to quit. Online referral portal at quitnowreferral.com. That is an online-based referral option, so if you don't want to deal with the paperwork of a fax referral form, you can certainly use the online portal. It takes away that hard copy form, and it will directly connect an individual with the Indiana Tobacco Quit Line. Also recommend, if you have the opportunity, to get on quitnowreferral.com and kind of navigate through that website. It's a really simple way to refer individuals to the Indiana Tobacco Quit Line. So we know that quit lines are effective among priority populations. I think we kind of hit on this already, but at the end of the day, the accessibility of this option is key, I think. So if you have individuals that maybe can't necessarily make it to a health system to access a one-on-one coaching session, or can't make it to the local group counseling session, this is a very viable option to help an individual access some form of service to address their tobacco use. So really, really important, I think, from our perspective, to let people know that the Quit Line is out there. It's free of charge to them, and it's available 24 hours a day, 7 days a week. So I'm going to get into a couple different strategies after I go through this slide, but we know that the integration of tobacco dependence treatment is really, really crucial across all sectors, in all honesty. So whether it be the healthcare sector, whether it be the employer sector, whether it be working with local health plans, so the managed care entities in and around the state, there's a lot of different buckets where integration of tobacco dependence treatment can work, and I think we just need to do a better job of coordinating what that looks like. So just know, from a state level perspective, we're certainly working or doing our best to try to partner as much as possible with healthcare systems to make sure providers are educated and feel comfortable with addressing tobacco use. Hopefully that they're comfortable with understanding what kind of medications are recommended and how to use those medications, so they can prescribe those medications to an individual if indeed it's necessary. And then, like I said, working with employers, managed care entities, whatever it may be, trying to really build a cessation infrastructure around the state that supports a tobacco user when and if they're ready to try to make a quit attempt. So this is from, these are from responses to the adult tobacco survey from a few years back, but basically what this looks at is the important reasons to quit smoking. So these were responses to questions of why it's important to quit smoking. So what drives an individual to try to quit smoking? And you can see that cost, their healthcare provider, smoke-free air laws, and workplace policies all play a role in helping to drive people to want to try to quit smoking. So I just want to briefly go through these. So the cost of the price. So I don't know how many of you are familiar, but recently, actually just last cycle, we tried to push for, or there was a push for, an increase in the price of the product, the price of cigarettes. We know that that certainly can drive smoking rates down because it's price-sensitive population. So the more it costs, the more likely someone's to think about not purchasing and trying to quit. Specifically, the impact of a $1.50 increase on cigarettes would avoid over 13,000 smoking-affected births over a 5-year period. Additionally, it would help current adult smokers that would quit about 58,000 individuals over a 5-year span. And then certainly all the economic sides of it, or the financial burden side of it. Cost savings from fewer smoking-caused lung cancer cases would be about $10 million, and then the long-term healthcare cost savings for the state of Indiana from smoking declines would be about $2.1 billion. So this is an evidence-based strategy. We know that increasing the price of the product drives down smoking rates. It's been studied for years. You look at the states that are doing a good job with this, the Californias, the New Yorks, the Minnesotas, their smoking rates are a lot lower than the smoking rates here in Indiana. So that's more of a statewide policy strategy. Just know that you can get involved when and if there is a campaign. It's important for all of you to be advocates for that, and know that even though it's a statewide policy, it does directly impact you at the local level and helps the individuals in your community think about the importance of quitting, and certainly drives them to quit. Looking at the next one, so smoke-free air policies, because we already kind of talked about the importance of healthcare providers addressing it with their tobacco users. So we know that you have less places to use your tobacco product. It's going to start to make you think about the importance of quitting and hopefully drive you to quit. So certainly adults cutting back because of workplace policies. Youth have fewer places to experiment in their community, and it certainly helps with relapse prevention when we talk about smoke-free air policies. In the state of Indiana, we do have a statewide law. It does leave out bars, casinos, fraternal organizations, private clubs, so there still are places in the state where you can go and use tobacco products. This is one that we really try to focus on at the community level, so the local level. We task our partners to really try to have the conversation in your community, gather the support in your community to pass a local ordinance that is stronger than the statewide smoke-free air law, because you are not preempted in this state, and you can have a stronger local level policy as opposed to a state level policy. So something else that can help drive down tobacco use rates. All right, and then connecting it back to infant health, this was a meta-analysis from 2014. It actually looked at, I think, 11 different studies that focused on 5 different smoke-free air laws. And from the meta-analysis, the adoption of smoke-free legislation resulted in a 10.4% reduction in preterm births and a 10.1% reduction in child hospital admissions for asthma. I don't know what that was, but... So again, just highlighting increasing the cost, increasing protection from secondhand smoke exposure, working with pregnant individuals, expectant mothers, whenever you get that opportunity to engage them on the importance of quitting. And then this is one other strategy that we're just currently embarking on. So the Polis Center down in Indianapolis, or IUPUI, recently released a report that really focused on place-based health. And basically what that means is, kind of where you live can dictate your quality of life and your expected, health outcomes. And specifically, it looked at the point of sale. So the point of sale is, think of that as basically your convenience stores, your gas stations, where the product is actually being purchased. So it looked at that in the Marion County area, and I just want to run through some of the statistics that they found, that there's over 8,600 licensed tobacco retailers across the state. There's 2,000 in the Indianapolis metro area, and basically what it looks at is the density of those tobacco retailers. So if you think about it, the more or higher rate of tobacco retailers in a specific area, obviously the easier access to that tobacco product. Certainly they see it a lot more, which can certainly reduce the chances of them truly trying to quit, because it is so readily accessible in those areas. And specifically, this Polis Center report, or IU Richard M. Fairbanks School of Public Health report, one of the indicators they focused on was maternal smoking in Marion County. And what they noticed was that maternal smoking was nearly twice as high in high access areas, so those places where there was a higher density of retailers that were selling tobacco products. It was actually 22.5% maternal smoking in those areas. The average was about 16.4%, so it was basically 7% higher than those average access areas. But in those low access areas, that maternal smoking rate fell to 12%. So a lot lower than that 22% where there's that high access area. So just another policy strategy that we're looking at in and around the state. Unfortunately, we are preempted at the state level, so we can't go into the local community areas and work on this specific policy strategy. We would have to do some things at the state level, but just something else to think about when you're thinking through how individuals, meaning tobacco users, based on where they're at, what they're encountering on a daily basis, these are all things that we need to be aware of, and certainly trying to pass some policy or push some policy that mitigates the access to tobacco products. So to wrap up, evidence-based tobacco control strategies include state and local programs. So I kind of highlighted that we work with local partners around the state. I think we have about 45 counties across the state that we fund to have local tobacco control experts working on evidence-based tobacco control strategies. We need to drive the price of the products up. We need to continue to push for comprehensive smoke-free air laws, the mass media campaigns that I talked about, and then barrier-free tobacco treatment. These are all some of those key strategies that the evidence strongly supports to help reduce tobacco use really across all populations, even though I know we're really focused on the pregnant population and women of childbearing age. So that's what I have. Feel free, I don't know, I'm sure I went over time, so I apologize for that. I want to be respectful of everything. If there are any specific questions, I'll take a few right now just to, again, be respectful of everyone's time. This is my information. If you have questions, please don't hesitate to reach out to me. More than happy to come to your locations and work with you on how you can continue to address tobacco use or connect you with a local partner that we have in your area. Yes, ma'am.
So a lot of the focus is obviously pregnancy as a catalyst to quit smoking.
Mm-hmm.
Is there focus or programs or anything that you know about of how we can, if we weren't successful in pregnancy, having that newborn be a catalyst for quitting smoking just based on the risk of SIDS and
Yeah, I think there's a lot of different ways that we can have the conversation, and how we frame that conversation is really important. I know from a state level perspective, we are very focused on infant mortality, which certainly goes past just the pregnancy. It goes up until the baby turns 1. So I think there's certainly a lot of different ways that we can frame that conversation. I still think, though, at the end of the day, we still need to try to implement some of these common strategies to help these individuals, specifically new moms, think about quitting. So I don't know if that directly answers your question necessarily, because I think it's really about framing the messaging, whether it be focused on pregnancy or focused on allowing this newborn to live as healthy of a life as possible. There's certainly two different ways to I think, spread that message, but at the end of the day, it's really about connecting them with the resources that are available to them to try to help them lead a healthier life. Mm-hmm.
So let's thank Brian. Thank you.
Yes.
You get 2 directors.
Awesome. Thank you very much.
And you can have some purple balloons if you want.